Looks like a few more people have already joined us, so we're going to go ahead and get started while everybody's calling in. We may have a few more people trickling in during the meeting, but I'm going to go ahead and get started. Welcome everyone to the first session of the PCA HCCN Professional Development Series for 2020. Woohoo! We're excited to be here. We've got some really good stuff to share, so I'm going to go ahead and get us started. My name is Sabrina Edgington. I'm the Director of Learning and Curriculum Design at ACU and work part-time with our STAR Center. The other part-time, I'm working with our other ACU programs, and I'm going to be facilitating the meeting today. And I'd like to have my esteemed colleagues introduce themselves. Maybe we'll start with you, Suzanne.
Hi there. Sorry, I wasn't sure what order we're going in. So anyway, hi everybody. I'm Suzanne Spear. I'm the Senior Director of Workforce Development here at ACU, and really thrilled for you guys to be joining us today. This is one of my favorite learning series every year, so welcome.
Thank you. And Michelle?
Hi everyone, I am Michelle Fernandez. I am the Senior Training Specialist here at ECU and with the STAR Center team. Really excited to have everyone here, and thank you for joining.
Thanks. And last but not least, Mariah.
Hi everybody, I'm Mariah Blake. I'm the Program Manager here at ECU, and I'll be floating around in the background for this series. I'm excited to be here and talking with you all. If you have any questions at all, find me in the chat, or my email address. I'll pop that in the chat as well. Looking forward to it. Thanks.
Thanks, Mariah. So if you're not familiar with the STAR² Center, we were established in 2014 as a branch of the Association of Clinicians for the Underserved to support the clinical workforce recruitment and retention efforts of health centers. And most of you know that we're supported through a national cooperative agreement with the Bureau of Primary Health Care, and there's 21 of us. So hopefully you're working with all of us in some way or another, but we're your workforce recruitment, retention, and TAP, as we like to call ourselves. And what we do is we provide free resources, training, and technical assistance to support your work in really developing a robust and agile clinical workforce for health centers. So just a few housekeeping things. We are recording the session, so you'll have access to that after this meeting. Please use the chat box to talk about things that resonate with you, ask questions, talk to each other. We want to make sure that you're using that feature to engage with each other. And as Mariah said, if you're having any technical issues, please feel free to reach out to her. You can message her directly through that chat feature. And then we do have an evaluation at the end of the session that we'd really be grateful if you complete for us. We are going to be very interactive during this session. And so you received an email earlier that gave you some instructions for connecting to phone audio. What we found is that if you don't log in or call in using your unique participant ID, you're going to have some audio issues during the breakout session. So we just want to make sure that when you called in, you didn't just stop at the meeting ID, you also entered your unique participant ID. If you didn't, it might be a good idea to recall in, so hang up and recall in and do it that way. If you're on your computer, you should be fine. You'll just want to make sure that you know where the mute and unmute options are in your computer audio, and so you can see an image there. The other thing we want you to do, which is going to help us with the breakout sessions, and I'm going to tell you how to rename yourselves in just a moment, but we're going to ask you to rename yourselves, and I'll tell you what to rename yourselves in just a moment. But the way that you'll do that is on your screen. At the top of your screen, you'll open up your participant list, and then it'll look like what you see on the left side of your screen, and then you're going to select more next to your name. And that will allow you to enter a new screen name. So I'm going to let you go ahead and do that right now, and then I'm going to tell you what to enter in just a second. But I just want to make sure everybody has a chance to look at these instructions and get to that part. There's another way that you can do that, and that's if you hover over your image or your initials, your name on the grid, you can select the ellipses, and then on the ellipses, you can rename yourself as well. So hopefully everybody is there, and here's how you're going to rename yourself. you're going to just put your group number in front of your name, and you're going to group yourselves by your HRSA region. So if you're in regions 1, 2, or 3, then you're in group 1. So if you're looking at my example, you'd be 1, and then Sabrina Edgington. If you're in regions 4, 5, 6, and 7, you'll be in group 2. And then if you're in regions 8, 9, and 10, you'll be in group 3. And that's going to help Mariah figure out how to best group you all when we get to our breakout activities. I'm going to look at everybody's names to see how we're doing. All right. Looks like most people have been able to do that. And if you're having any problems with that, just send a message to Mariah and she can help you with that. If you haven't had a chance already, go ahead and rename yourself. And then while you're doing that, I'm going to go ahead and move forward with the rest of our presentation. So just to give you an idea of why we're doing this series, really it's to provide a space for professional development and collaboration to support your workforce recruitment and retention efforts. And so how we want to do this over the series is a few different ways. One, we do some train the trainer sessions. So we want you to know how to present content using the STAR Center resources in your workforce TTA programs. So by the end of the session, you're going to feel familiar using some of the tools and doing your own TTA with your health centers. But we also want you to be building a network. So we want you to build a community with other workforce leaders, become comfortable leaning on one another for support. We also want to keep you informed. So as a workforce leader, sorry about that. So as a workforce leader and trainer, you really benefit from knowing what your colleagues are experiencing and then hearing about those promising practices all over the country. We want you to be informed about what's going on, what the trends are. And then last but not least, we want you to feel inspired. So let the conversations inspire you in the work that you're doing and hopefully re-energize your spirit in this work. So I want to do a poll. And we're going to use a tool called Mentimeter. And if you haven't used it before, it's a really good way to engage people, to get your audience to respond to questions, and just to break up the session a little bit. If you like it, I encourage you to use it in your own TTA. But there's a couple different ways that you can answer this poll. One, you can take your phone and just turn on your camera and hover it over this QR code. And then your phone is automatically going to take you to the Menti site where you can respond to this question. Or you can click on the link that's in the chat room, and that will take you directly to the poll question. And I'm going to take us to that poll right now so you can see how people are responding. So we've asked, have you participated in the PCA HCCN Professional Development Series before? Wow, we've got a lot of newcomers here, so that's really exciting. I'll let a few more people respond. Okay, so it looks, 10 of you so far that have responded, 11 have never participated in the series, and then the rest are. So welcome to all the new folks who are first timers in this series. We hope that you find it exciting, and we're glad that those of you who have participated in the past are coming back. So hopefully you found some value in the session, in the series before this, that make you want to attend again. So I appreciate that. So going back to my slides. Oh. Sorry about that, guys.
I'm seeing your slides again, Sabrina.
Oh, gotcha, gotcha.
Yeah, it all looks good.
Okay, perfect. All right, so let me tell you what to expect in the PCA HCCN Professional Development Series. So today for our kickoff, what we're going to do is give you a lay of the land. We're going to talk about health center workforce TTA needs. So we're going to be sharing with each other through some really interactive activities and through our breakout sessions what we're seeing in our states and regions. Then in the next 3 sessions, we're going to be doing some train the trainers. So these are really focusing in on how to help your health centers develop a comprehensive workforce recruitment and retention plan. And so we're going to break that up into 3 different sessions. And then the last 2 sessions are going to be based on TTA topics that we learn about today. So in our conversation today, we're going to be seeing what's trending. We're going to see where you're successful. We're going to be seeing where you're having some challenges in providing workforce TTA. We really want to tailor those topics around your specific needs. And so for today's agenda, you'll understand what you'll get out of the series, which we just talked about. We're going to talk about health center workforce TTA needs from a national perspective. And then we're going to go into our activities and talk about the state and regional TTA needs. And then we're just going to walk through a few new STAR Center resources that we think you might like. So let's talk a little bit about the National TTA Needs Assessment. Some of you may have already seen this before. Back in 2018, there was a TTA Needs Assessment that was sent out to all health centers across the country to find out where they need training and technical assistance. It was a very comprehensive survey. And what they found out is that 84% of the respondents said that they were in need of support around workforce. And that was the second highest TTA need, next to transitioning to value-based healthcare systems. So we're seeing that there's a significant need for workforce TTA. And if you break it down a little bit, what they found in terms of the specific workforce needs is that most health centers really needed help developing a comprehensive staff retention plan. And that was closely followed by developing organizational strategies to reduce clinician burnout and improving job satisfaction. So you'll have the slides so that you can reference this list, but this is where we're seeing most of the needs coming from the national perspective. Since I'm going to be asking you all to share some of the TTA requests and needs that you're seeing in your states and regions, we wanted to be able to share what we're seeing here at the STAR Center. So the most common questions we receive from health centers is, what is a comprehensive workforce recruitment and retention plan? So health centers are now required to develop a comprehensive workforce recruitment and retention plan. And there's been a lot of questions about, well, what all is supposed to be in it? What makes it comprehensive? And so we, obviously, we talk very closely with HRSA and our project officers. And so we've identified that our plan does serve as a comprehensive plan. So we encourage you to use it. And this is one of the reasons why we're going to really train you on how to use it so that you can be working with your health centers to help them develop their plans. The second biggest question we get is, how can I get health center leaders to invest in recruitment and retention strategies and solutions? So a lot of times we're hearing from workforce leaders about the need for stronger recruitment and retention strategies, but there needs to be an investment in that. And so there needs to be a discussion about the business case, the return on investment, and what it really means for the health center when you're seeing a lot of turnover. So that's one of the other questions we receive. And then the third biggest question I think that we receive is, what can health centers do to prevent burnout? And we're not really looking at some of those lavender approaches. I think a lot of times, a lot of health centers and leaders and others who are working with health center providers lean to those approaches such as yoga and meditation, taking time out for walks. That is great, but there's also a lot of things that organizations can be doing operationally that can also help with burnout. There really needs to be a balance of both. So what are our most accessed resources? So the number one access resource from our end is our provider recruitment retention plan template. By the end of the series, you are going to know that template very well. You're going to be able to walk through it with your health centers. The other resource that we share on our STAR Center site is SHRM's Developing Employee Career Paths and Ladders. Obviously, that's a huge factor in retention. If people aren't growing, they're going to go somewhere else where they can grow and advance in their career. So you want to make sure that there is a pathway for them. And then our third most commonly accessed resource is our STAR Center Turnover Tool webinar series. So we have a tool, and then the webinar series helps people to understand how to use that tool to not only assess turnover at the organization, but also to assess the impact of turnover across many different factors of their organization. So this is the breakout of our comprehensive provider recruitment retention plan. You don't have to memorize all of this right now. I just show this to you right now because I want to see how many of you are familiar with it. And so I have another poll that I want to ask about the plan. All right, so again, if you go back to that Menti link, or if you still have it up on another tab or on your phone, you can answer these questions. The first one is, I'm familiar with the components of a comprehensive workforce recruitment retention plan. And then the other one is, I feel comfortable providing technical assistance on creating a comprehensive workforce recruitment and retention plan. I'm going to give you a minute or so to complete your responses just to see how we're feeling around this. So see the people who are most confident entered in their responses very quickly and entered them in first. And so as we're thinking about it, looks like about half of you are familiar with the plan, but then just a little bit less than half of you don't quite feel comfortable walking a health center through that plan in order to help them to build that plan and implement it at their organizations. Great, that's really helpful. So the other thing I want to note for you is that the recruitment and retention workforce plan template is very data-driven, very logistical, and really focuses in on very specific things that you can do at your health center. It does not get at some of the other aspects of our workforce that are important to workforce recruitment and retention. It doesn't get at the character, the spirit, and the integrity of the health center, which is just as important to recruiting and retaining your health center employees. And so that's why we complement our trainings on the workforce recruitment and retention plan template with the components of a high-functioning health center, because these are really getting at that character, spirit, and integrity. And so I have another poll for you. What I want to know is, I want you to think back on your most frequent TTA requests over the year. Which category do they fall in? So if you go back to Mentimeter, you should be able to go to this question. So thinking about your most frequent TTA requests over this past year, what categories are they falling in? Wow, so we're seeing the most coming in under policies that support diversity and cultural respect. Absolutely. There's been a lot going on in our country around this, and there's been a lot more support around it. We're also seeing a little bit of a tie between tested and recruitment retention strategies and health professions training programs. And you are able to select more than one. So if you have a couple that you're saying, well, I don't know which one we're seeing the most of, but there's actually two, go ahead and select as many as you think is appropriate in terms of how frequently you're receiving these TTA requests. All right, this is interesting. Okay, so still policies that support diversity and cultural respect is in the lead, followed by tested recruitment and retention strategies and health professions. Oh, and equitable and effective compensation structure. Great.
Can I ask a question, Sabrina? For those who put other in there, Would you guys mind either, I don't know if you guys can come off mute or just enter in the chat? I would be interested to see what the other part was.
And just a little trick with Zoom, if you press on your space bar, you can temporarily unmute yourself. Okay, so we're seeing from Katie, policy sharing in general, but especially with COVID is a big request, absolutely. Anybody else want to share some of the other requests that may not fall within these categories?
Hi, can you hear me? This is Yvette from LPCA.
Hi, Yvette.
Hi. Our other that we receive a lot of requests for is an FQHC 101 training for new staff. So it's like an orientation training that we do for new health center staff to orient them to the world of FQHCs. They may have worked in healthcare before, but of course, FQHC world is very different.
Absolutely. And it's funny you bring that up because in our high functioning managers training that we just did yesterday, we walked through a case study where a staff person came in from the private industry into the FQHC, which runs a lot differently. And it created some issues, but not issues that couldn't be resolved or anything. But there was some onboarding and orientation that needed to happen to help them assimilate to the health center culture. Thank you for sharing that. Anybody else? All right, well, let me keep moving. So what I want to do now, it's time for breakout groups. What we're going to do is we're going to go back out, we're going to go into breakout groups based on the number that you put in front of your name. And then we're going to reflect a little bit more about those TTA requests. We wanted to put you in smaller groups so that you could have a little bit more conversation. An ACU staff person will be in that group to help facilitate that conversation. And then we're going to come back out and do some sharing.